On this episode of Clear the Air.
No, back when I was in the Army, they had us do, you have to do NBC, nuclear, biological, and chemical warfare training. And that's what you do, is you have a big area, and you come into it, and you're not allowed out of that dirty area, and you have to wipe everything down. So everything he's doing is nuclear, biological, and chemical warfare. I would like to see more open dialogue, but I want to see the dialogue pushed outside of the pharmaceutical realm, because I think the myopic focus that our culture and our society has, expecting that the solutions to healthcare issues are going to come from pharmaceutical, and you Americans are so dumb you don't understand meters and feet.
So we should have been
20
feet apart,
36 feet, 6 meters, which is like 36, 40 feet apart. And one of these doctors down there was like, yeah, it was supposed to be 6 meters. And someone there in the U.S. government just said, well, 6 meters and feet is the same thing, 6 feet.
We'll want to edit his math out. It's closer to like 18 feet.
Welcome to Clear the Air podcast. I'm your host, Nate Jones, and I'm here with our co-host today, Shad Slaughter.
Hey, everyone.
Today we're going to look back at the COVID epidemic and the guidance that our government agencies, public health agencies, gave us, and was it good, bad, mixed, or how was that? And I wanted to bring up that the reason why we wanted to bring this up right now was because in the morning when I'm working out and exercising, I know it doesn't look like I exercise that much, but I try to. You should, if I don't exercise, see what I look like. But I'm watching the House Judiciary Committee and their oversight hearings on how and investigating into how our public health agencies responded to this COVID disaster and this public health response to it, which was also a disaster. And it just made me think that even in those committees, they're still focusing, highly focusing on after you're sick solutions and not prior to the COVID pandemic solutions. And I think that history is going to repeat itself, because if we don't reach outside of that box and figure out what went wrong with public health, it's going to happen next time. Next time, whether it comes from a lab, whether it's, our government funding gain of function research, or whether it comes from a bat cave in, the South China Seas or something, or New Mexico, we're going to have a bad response if our public health agencies can't address it in a timely and an intelligent manner. And COVID's the same way. If our public health agencies had actually addressed that in a sane manner, COVID would have been a nothing. It would have been a nothing sandwich. And so that's what we're really going to talk today about.
Go ahead. I think it's important to note that we are in a lawsuit currently with the FTC, and that also, as we look back, there is the benefit of hindsight. But Nate, I think you bring up a great point. This is when we need to be transparent, especially lawmakers and policymakers need to be transparent and say, okay, we have now hindsight. How do we make sure that in the future we do things appropriately? So we do understand that there is hindsight looking back at this as we talk about these topics, and just wanted to be transparent that we are in a lawsuit with the FTC that involves some of these issues.
Yeah, I think we bring that up on every episode just to be clear. We are very clear. Yeah. Because that's the name of the company, Clear. But we are very transparent. Yes, our great and glorious FTC is suing us because we were trying to share published data about hygiene, nasal hygiene, early on in COVID, when they had studies showing that just simply washing your nose with a saline, which we don't sell. We don't sell a saline. We sell a nasal spray with xylitol, was effective. And the FTC, in their infinite wisdom, figured that salt water that had been used for thousands of years would be detrimental, and so they censored not just us, but they censored other companies in the industry. So, yeah, we're very clear that the FTC is suing us. We still think there's no basis for that, and that they need to be reined in like a couple of jackals.
Yeah, jackals. I'm glad you're exercising this morning, though.
Well,
you do what, like 7 miles on the treadmill every morning?
I'm sometimes in the summer, and I went out to a concert last night. Shout out to Styx and Foreigner, great concert, great show. Yeah. And so I didn't get home until about 11:50, just after midnight. So I slept in a little bit. So I only got in about 5 miles.
Oh. I think I did about 5 miles, but most of it was in a cart. I did 9 holes of exercise this morning, and it was a beautiful day.
That works. Yeah, golfing. Golfing is exercise, kind of like riding a horse is exercise.
But you bring up exercise, and this is kind of, I just wanted to point out, diet, exercise, and
hygiene.
Hygiene. You hear doctors talk about diet and exercise, but hygiene is a critical part of that, and so kind of goes into what we're talking about today.
Yeah, and I think we've had an episode on this where I've kind of pointed out that if you talk about public health, and this is my opinion, that public health, the CDC, the Surgeon General, and the state public health agencies, they really don't talk about exercise, nutrition, and hygiene. And when we're saying hygiene, we mean hygiene and sanitation. Hygiene is personal cleanliness. Sanitation is communal cleanliness. And so those two are used interchangeably. But those are really the 4 pillars of great public health policy. We know that going back for thousands of years. We know that there's been many epidemics, pandemics and epidemics solved through hygiene and sanitation. There haven't been any that have been solved through pharmaceutical products. So
I think that's a good segue. Let's jump into it.
In a segue? Isn't that a little cart?
Yeah. Guy died on his own invention.
Did he really?
Yeah. The inventor of Segway died on a Segway. It's actually sad. I don't know why
That's actually funny.
lips are smiling.
It's not
sad.
Funny. It's sad. Okay. Let's go back and look at some of these interventions that public health put out in early 2020. And granted, I was sitting here in 2020 and I was listening to all these, and a lot of them I did. For at least the first couple of months, they started coming out with these in March and April of 2020. Just like the rest of America, I thought we were in the midst of a pandemic that was going to wipe out society. The media was, as we know now, blowing it way out of proportion and putting the fear of Jesus into us to obey or we were all going to die from this crazy illness.
What were some of those moments that stood out to you going into the pandemic? Some of the key moments.
One of my favorites is, in hindsight, was in February. There was a doctor. We were having a meeting, and there were some people from Clear out there in Washington, D.C., and they were meeting with the FDA, and I was actually here, but I was listening into this phone call. And one of the doctors that was in there in this meeting, as they were wrapping up this meeting, was like, hey, these nasal sprays, these nasal sprays that have things that block stuff, this flu that's coming around the world, that's coming around the globe right now. Again, this is February. This is before anything happened really here in the U.S. You guys should look at using these nasal sprays and stuff like that, hygiene, for this flu that's coming around the world. And the people at the FDA kind of giggled and laughed and said, that's not going to be anything here. We have the best healthcare system in the world. And I look back on that now, and I was just like, really? That's great.
And I remember at work, we was every day talking to coworkers, and it was, what's the infection rate in a city or in a state, or what's the infection rate in our city or state? One of my memories was I was teaching a class at the local university, and they were building that hospital in Wuhan, and it was some 2,000 bed hospital that they were building in 2 weeks.
Yeah.
It was some ridiculous time, and I was teaching a project management course, and I thought, wow, this is such a great real life example of how amazing it can be when you get a whole bunch of people working together. It was this perfect example of a macro project happening in real time. And so we would talk about it at the beginning of class. And after the third class, I had a student raise his hand and say, I wish you would stop fear-mongering about this and getting us all afraid. And I wasn't sure how to respond because the example was the hospital that they were building. But I think it gives kind of a sense of where people's minds were at. They didn't really know what to think.
I don't remember the specifics of it, but I was concerned for probably 2 to 3 months. I believe that it was, like everybody else, I believe that it was a pandemic. I believe that there was something happening. It wasn't until May of 2020 that my ideas changed, and I started seeing that it wasn't really that it was a pandemic. If you've been around me long enough, you know that I refer to it not as a pandemic, but as a pandemic. And the reason for that is because, yeah, we had a virus. There was an illness, but every single option every single decision that public health made was the wrong decision. The whole 6 feet and the masking and all of this and staying home and eating pizza and takeout and not exercising, waiting until the very last minute. I mean, every one of those just once you start seeing that kind of ridiculous bad behavior, bad decision making, you realize that's not accident.
Let's break those down a little bit. So social distancing, the 6 feet, you mentioned that. What was the issue there?
Well, I didn't have an issue with it. I'm not a great understander of where it came from, but I've heard a lot of stories. Fauci recently just came out and said, we made it up. It didn't come from anywhere. There was no scientific standing for it. I was actually down in Costa Rica, and I was chatting with some of the doctors, and this was in December of 2020, I want to say. And I was talking to some doctors there, and one of them said, well, it's because Americans are dumb. And I'm like, how do you why are you calling us dumb? He goes, well, because they came up with 6 meters, and you Americans are so dumb you don't understand meters and feet.
So we should have been almost
20
feet apart?
36 feet. 6 meters, which is like 36, 40 feet apart. And one of these doctors down there was like, yeah, it was supposed to be 6 meters. And someone there in the U.S. government just said, well, 6 meters and feet is the same thing, 6 feet.
We'll want to edit his math out. It's closer to like 18 feet.
6 times
3
3
feet it's roughly
I'm
3
thinking
feet
6
in a meter.
times 6. Why am I thinking 6 times 6? Yeah, that's dumb Americans. They just don't understand the meter system.
I think it was that context that I think it's important.
Oh, well, there you go. Anyway, but Fauci and the other ones, now they're coming out and saying, yeah, we just made it up. We made it up on the fly. And you would think that I'm not going to sit here and second guess them. When you have something like this, that the media and the people are, they're getting the crap scared out of them. They want something. They want some kind of a guidance to make themselves feel better. So I don't begrudge these guys for doing it, because it is something that they can do. But at the same time, they shouldn't be mandating. They should be making suggestions. If they have something that scientifically that they can show is going to work 100%, then do it. But don't mandate it on people.
I think you bring up a good point. It reminds me of the seeing a doctor for an ailment, and the doctor says, well, take 2 aspirin and call me in the morning. And what that actually is the doctor is not super concerned about the ailment, but the activity of taking those pills and getting a recommendation puts the customer at ease. And what the doctor is implying, that by the morning they'll feel better. And without the Tylenol or the aspirin, they'd probably feel better in the morning. But that act of taking the 2 aspirin is kind of that instruction that makes me feel better. And I think there was a lot of that going on, but it kind of crossed the bridge into like mandating it. The doctor doesn't follow you home and make sure that you take the aspirin.
So, my dad is a physician. Yes. And you know what he would always say about where that came from? Take 2 aspirin and call me in the morning.
What did he say?
He said, well, that's because the doctors are usually out getting their exercise on a cart in the evening, and they don't want to be disturbed while they're getting their exercise in a golf cart. So take 2 aspirin, come in the morning when I'm in the office.
Well, I had a friend that was an ER doctor, and they would do that where it was just something that they could give the patient to put their mind at ease, but they weren't experiencing something extreme. But I think there's a lot of that went into it, where I think the mentality was, do we have the scientific evidence that this is going to work? No, we don't have the time or evidence. Do we think that this will help calm nerves? Yes. But at some point, it went from this helpful means to becoming policed, and ultimately caused a lot of, I think, social harm and division.
Oh, I think a lot of their mandates and directives caused a lot of harm and, as you said, social division. That's ongoing today, and I don't think that's going to be those bridges are going to be mended in our lifetime. That's how much credibility I think has been lost by our health system, public health, the medical establishment as a whole.
So, so there's social distancing, the 6 feet. What about masks?
Well, again, I had masks. We provided them for everybody in the company. We had them here.
Those were hard to get at some point. We had to go. Fortunately, as a manufacturer, we have great relationships with producers, and we were able to get several boxes. But there were shortages on the masks.
Yeah. Good thing we took them away from all the doctors that needed them.
That is definitely one of the issues that they were running against, right? They said, everybody wear these N95 masks, and then they said, wait, don't use the N95 masks. And that was to allow the doctors to get supplied with them, and then they came back to the masks. So
yeah, I remember we had some cloth masks that we had made. I remember those little black ones with a little green logo. But we didn't have those until, I want to say, April or May, June of 2020, because... Right. Had gone down to Florida and met with some doctors down there before we got those cloth ones. But no, I think that masks, there's a lot of studies showing one way or the other. If I really thought I was going someplace where I had a chance of being exposed, I would wear a mask. I mean, I wore them when I went on airplanes, and I wasn't opposed to them. I don't think they're as effective as what people were telling everybody they were. I mean, people were like, oh, wear a mask or you're going to get sick or you're going to expose grandma and you're going to... But even if you reduce the viral load, by a little bit in what you're taking in, but I think that there's also the argument that I see a lot of people make that by not being able to exhale bacteria and viruses and by increasing the carbon dioxide in your airway because it's trapped behind a mask, I don't know if I buy that argument hook, line, and sinker also. I used to hang insulation when I was going to college. I used to hang insulation, and I would be wearing a mask for 6-7 hours a day, an N95 mask. And so I don't remember ever getting sick and falling over from lack of oxygen back then. So I think there's two sides to that argument. I just don't think either one of them is strong enough for me to opine on.
Well, I think that's what's interesting is that, again, there wasn't conclusive evidence, but the social pressure then turned it into, pro-mask, anti-mask, right? Or pro-distancing, anti-distancing. And everything, it became two sides, and it was less relevant what the actual science was and more relevant kind of us versus them mentality, which ultimately, I think, we're still feeling the ramifications from that divide. And I think that going back to it, this is something that people that develop social policy and health policy have to recognize. Like, human nature is instinctively tribal, and if we create systems that kind of feed that tribalism, then this is the result. So what should they learn from this?
Not to force people to do anything, not to mandate things. I mean, I just started giggling, laughing when you were talking about that because, pretty soon, I mean, by late 2020, you could, if you remember, there was a lot of division on everything.
Sure.
And it became political, which to me is absurd. I'm a very centrist political person. I don't know if I want to admit who I voted for in the last election, but it's probably not going to be the same one that I vote for this election.
Yeah, I voted for someone who isn't on the ticket in the current election.
Well, dude, you just write them in. I mean, I write Alibaba in on all of them.
Well, maybe he'll get 2 votes this year.
Oh, well, great. But what made me laugh is how when you brought up the tribalism, it was such, and I saw this happening in real time because I was paying attention to it by then, because I realized that something was wrong with how we were being fed information. But when they came out with the vaccines, before the election, it was, you had the left saying, I'm never taking one of these vaccines. I'm never taking them. I'm not taking a rush vaccine.
There was a switch.
And then the election happens, and it's like, okay, everybody get a vaccine in every arm. And all the left people were like, line me up. I'm right here.
Yeah.
We're talking about the same vaccine.
Right.
I'm getting a vaccine based on who's sitting in the Oval Office and nothing else.
Pre-COVID, a vaccination table at Whole Foods would never have been visited. Post-COVID, it's the most popular stop at Whole Foods would be a vaccination table.
Yeah.
And and vice versa, right? Like the people that were, pharmaceuticals are business, pharmaceuticals are great, are now, we don't trust pharmaceuticals are ruining everything. There was this really quick switch of alliances or allegiances.
Yeah, no, and that's bizarre to me. I mean, I have a lot of siblings. We've discussed that, and we have some pretty good debates and discussions with my siblings on that topic. So,
Nate, I'm sensitive to the issue of coming up with policy that affects other people at a much smaller scale. We were, of course, impacted. We weren't sure what to do. We have about 70 employees that come to our warehouse and our production facility every day. And I was struggling for several weeks trying to determine what was the best path forward. And I started realizing, am I really the person that should be making the decision for 70 people, or should that decision be made by the individuals? And so what we did is we basically approached all the employees. We got them around and we said, look, there's 3 options that you've got here. The first one is that if you don't feel comfortable, if you're afraid of this and you want to quarantine and not be subjected to it, you will not lose your job. You can stay home. It's unpaid leave, so you can use PTO and those other things, but you won't lose your job if you don't come to work. The other group, the other option was we're going to make it as safe as possible and do everything we can based on the guidance that's given to prevent spread at our facility, but you can come to work knowing that there is a risk. Then the third one was you can ask us to terminate you and you can try for unemployment, or you can quit and try for unemployment. And I think what the thought process behind that is I recognized that I shouldn't be making the decision for other people in their own personal decisions. Some of those people, the income was much more important than the risk. And in other people, the risk was way more important than the income. And it wasn't up to me to make that decision for them. And I think it worked out really well. We had a handful of employees that said, you know what, I'll come back when things cool down. And they stayed out for varying amounts of time, from a week to several months. And when they came back, their jobs were there. Those employees that decided to keep coming to work, we did what we could. You authorized us to buy meals because we were running 2 shifts. So we were buying lunch and dinner every single day for all of the employees that were there, which was also helping some of the local restaurants that were not getting as much walk-in traffic. And so they were able to bring these large orders over. And I think I fully appreciate that a macro scale, that's a very micro scale with 70 employees in a company. But I think that's the mentality that really should be taken, is guidance, education, but ultimately people should be allowed to make a decision based on their circumstance and what they feel comfortable with.
I agree. I mean, I'm thinking back and I'm trying to remember if I ever forced or mandated or, told someone to do something that they, didn't want to do during that time frame. I don't think I did. I hope I didn't.
Yeah, the only thing we mandated is if you weren't in production or shipping fulfillment, you were working from home. So we set up everybody else to work from home.
Came into work.
All of our customer service, all of our accounting, all of our marketing, all of our sales, everybody else, we set them up to work from home. And our IT company did great. They had customer service set up in less than a day to work from home. But
yeah, and they're still working from home.
They are.
And they like it.
Companies have had a hard time. They said that COVID probably accelerated the flexible work approach by about 10 to 15 years. So,
well, unless you're what are the big banks that are mandating everybody to go back to work now?
Yeah.
So, anyways. So do you think that shutting down the schools was a good idea?
Again, I think that my thought is that...
Well, first let me clarify.
Yeah.
We live in different counties, and
Totally.
so different school systems. How, you live in a very much more left-wing. I live in a more right-wing county. How was your... did they shut your...
Comparative nature nationally, it's not. But, yeah, so our kids went to... They had a full year of school from home, or the rest of the year, from home. And then I believe the following year they went to a 4-day school and then learn from home on Fridays. And then they had stuffs where they had to wear masks and they had to do all of those other things. And honestly, we loved the Fridays off because then, we could plan hiking trips and go skiing. And
so my kids, the first week when it was 2 weeks to slow the spread, that was the only 2 weeks that they didn't have school. The rest of the time, it was school as normal. They did wear masks for the school year of 2020 to 2021. But, at the school where my kids were going in Provo, they had, they missed 2 weeks to when they were doing the slow the spread, and they had to wear masks the next year. But my kids would come out and at school when I was picking them up, and 3/4 of the kids had the mask down around their neck, covering their chin. They weren't worn properly, and most of them were cloth masks, which cloth masks, you can argue that they don't do anything. I mean, right. You can't make another argument. But that's, mostly what it was. And so other than that, I had to wear a mask when I got on an airplane, which I do a lot of, and when I go into Costco or Target or Walmart.
Yeah.
So
the other thing I did notice, because they did shut down a fair amount of business for a few months in Utah, and I would look out my office window on I-15, and the speed limit increased from like 70 miles an hour to 120 miles an hour.
Yeah.
People were going really quick on that open road there.
I remember driving on there, and it was, seriously, you could do 150 because there was like right. 5 cars out there.
There was a fascinating statistic a few years ago that they said accidents are up, but death from accidents is down. And what was happening is that there were fewer accidents, but the accidents were happening at such a higher rate of speed that fatalities were higher. And then when people started driving and stuff, the number of accidents started increasing, but the number of deaths decreased because they were slowing back down. I think that the school thing, I think it's a good point because we live roughly 50 miles away from each other, and there was a different approach. But local municipalities, governments, state governments, there was always this kind of push and pull between we know what's best versus a federal mandate. And I think what I would often bristle at is that the news the national news is based in these very, very densely populated areas. And so they're putting their, kind of bias to the way things should happen from an extremely densely populated area. And then if you're in, say, rural Utah, it's a very, very different situation. But the mandates were coming from those locations, and they were being applied into areas where it made virtually no sense.
Are you calling Provo rural?
I was thinking more of, I don't know, Altamont.
Oh, I don't know where that is.
I had a friend that went there. He graduated with the class of 1, so a class of himself.
Yeah. No, and I hear what you're saying. I have a friend that lives up actually just north of you, and he was a little frustrated because he was out walking down the street trying to find his daughter, who was, I want to say she was 12 or 13 at the time. And the neighbors called the county health department on him, and they went over there and cited him because he was walking down the street without a mask on.
The Thanksgiving of 2020, we had a bunch of family over and found out that there were some neighbors that had sent some pictures in to show that we were not having our solitude Thanksgiving that was kind of nationally recommended. And in fact, I think Fauci said something specifically, if you really loved your loved ones, don't get together this Thanksgiving. We'll have to verify that.
We got together.
Yeah.
I had a lot of people over. And you know what was funny? I actually remember this now because we've discussed this in some of the articles that I've written. But there was a paper that came out that actually showed that if you what they said is get together in small groups, open the windows, and what the paper, this is actually going to be funny if I can find it, but it showed that because of the patterns of air circulation, if you open the window a little bit, it would probably, theoretically, increase your risk of COVID because it keeps the air circulating. So if there's
circles through.
So if there's tiny particles of a virus floating in the air, rather than having it settle down, the air circulates in and keeps it floating up to your face level, so you breathe more of them. And I'll try to see if I can find that article, but we saw that and we just started laughing. But no, we had by Thanksgiving I knew that it was kind of I don't want to say a scam, but I knew that it was blown so far out of proportion that you couldn't believe anything in the media. So we had a Thanksgiving and we had a bunch of people there, and none of us got COVID. So,
and I think this is where, when we're talking about the masks, this is where we started to say, hey, if a mask is meant to prevent the particulate from going into your airway, then a logical next step would be to properly clean or take care of your airway.
Dude, don't say that. The government's going to sue us.
But that was kind of the logic behind it, and that's
the government doesn't like logic.
And yet, when we talk to local health officials, we talk to national, we spent a lot of money trying to connect with these officials, and by that point, the vaccine was out, and that was the mandate. And ultimately,
we actually reached out to them starting in June of 2020.
That's right, because we were talking
we had data, and we had preliminary data, and a lot. So the data that we had in June of 2020 was, we knew that the grapefruit seed extract that we use in our nasal spray, that we've used in it for 23 years, would annihilate the SARS-CoV-2 virus. And we also knew, the study out of Tennessee, that xylitol blocked adhesion of the SARS-CoV-2 virus. Again, the FTC argues that these studies are garbage studies. They're done by the NIH and great universities like Vanderbilt. We knew by June of 2020 that washing your nose with a xylitol nasal spray would probably be fairly effective at reducing it. And the reason why is because even the studies that were done looking at bacterial adhesion, which were done in 1998, which are the studies that my dad looked at before he started utilizing in a nasal spray to prevent ear infections in children, they didn't show that it reduced adhesion to an undetectable level. It was like a 70% reduction. It was a 40-something% reduction in H flu, but it was none of them was to an undetectable level. And the study that was done at the University of Tennessee, it showed that xylitol blocked adhesion to an undetectable level. We've known from 20 years of experience at this point in 2020 that if you can block a significant amount of bacterial adhesion, you're going to reduce the respiratory infection. And going back to the lawsuit that they have, we tried sharing this data with the government. And rather than actually asking any questions, they sent us a warning letter and said, stop sharing that data, which I thought was absurd. I mean, we're in the middle of an epidemic, a pandemic. And at this point, I still thought it was a pandemic. And rather than saying, hey, here's something that would cost pennies and it's a hygiene solution and it's completely safe, let's at least ask a question.
And it's widely available.
Oh, yeah, it's widely available. And not just about our product, but about our competitors' products, right. The saline products. So again, the studies showed once you had COVID, they were nearly 100% effective, much more so than the vaccines, at actually treating it. They were 100% of the people in all the studies that they used saline all got better. But it was really, you could easily fathom that, which is why in June of 2020. We, working with some pulmonologists, actually went to the FDA and said, hey, we would like to do a study on this. We're not going to go and invest millions of dollars in doing a study if we don't think that there's a logical reason for that to work. And, when we were trying to get the government to do that, so we had a fairly good understanding that utilizing a xylitol nasal spray or a nitric oxide nasal spray, or an iota carrageenan nasal spray, or there's a bunch of them out there that we knew would work.
Yeah, and I think that's the part that perplexed me in all of this is that they said, okay, social distancing may work, but it feels logical. Create distance between the virus leaving one human and going to another. Washing surfaces was the next one. So, okay, you're not going to always social distance and there's going to be movement of people. So washing surfaces, that seems logical, and get rid of the virus. And then it's like, okay, well, you may pick it up, so wash your hands. Again, it may work, seems logical. And you know what? Even if you wash your hands and stuff, wear a mask to prevent it from going in. May work, but it seems logical. So to me, the next logical step was, and if it gets into the nose, like it's just one after the other, but there was this big gap where it said, wear a mask, and then the next step is ventilate.
Where does the logic of washing your groceries in the hallway come in?
Washing your groceries in the hallway?
Yeah.
Was that part of it?
There was a whole ABC segment. What's the guy's name? He was on Joe Rogan, the doctor for ABC News. Oh. Yeah. Anyways, he did a whole segment on the proper way. Sanjay Gupta.
Oh, yeah.
He did a whole segment on the news talking about how to appropriately wash your fruits and vegetables and your groceries and sanitize them in the hallway before you bring them into your house.
That's fascinating.
No, it isn't. It's stupid.
Well, but that's my point is that everything was on the table. It was this try everything approach until the virus entered the body, and at which point they said, vaccinate or intubate.
Yeah.
Right? Or ventilate.
Ventilate.
And it was, but it was like, well, wait, why can't we work on washing the vaccine off of the internal surfaces? Because if it goes in, the vaccine's dangerous when it got to the lungs. It wasn't dangerous if it went into the stomach because it would just be.
Yeah. And, everything that we talked about for 20 years, there was a paper that came out of Stanford that actually said that, yes, we're, correct and right.
So that they would promote this. They would promote this as an effective behavior against a virus, but using nasal spray couldn't be suggested.
Correct.
To wash out your sinuses where the virus grows.
Yeah.
That's amazing.
Can you give us some sound on that? Watch this. This is so dumb. I mean, it's 2 minutes. We got 2 minutes.
This is a question that Cheryl sent in to CNN.com, which reads, can COVID-19 be contracted by ingesting it on produce from the supermarket? Sanjay?
So it's interesting. You're not. This is not a foodborne illness. I just want to make that clear because a lot of people think if you eat this virus because your food's been contaminated, could you get it? You can't. I mean, this is a respiratory virus. Right. So it's more a question of the packaging. You just have to think about is there any risk of contamination in other ways? But you're not going to get like a GI type thing from eating the virus.
But so Sanjay, if people feel compelled to sanitize their groceries. I know, just like we did with the hand wash, and we asked you to film a tutorial.
What? So I can't believe they made me do this.
Can you guys see it?
People do need to grocery shop, obviously. Try and limit the number of times you go to the grocery store. That'll just allow you to keep better social distance. And keep in mind, this is not a foodborne illness. You're not going to get.
I thought he did it in the hallway before. He already brought the virus into his house, so why is he?
But we do know the virus can live on surfaces. For example, steel and plastic for up to 3 days. I've used a little glitter here for my kids to show you what the virus might be like. So what I've done here is I've created a dirty area.
You should put this clip on there and laugh at it.
This is crazy. So he's washing off the surfaces. And what was our recommendation? That you wash off your
nose,
your sinus surfaces.
You don't need to use any kind of specific.
But it's effective for a Campbell's soup can.
I know.
But not for your sinuses.
Exactly.
Got this clean. I put this into the clean area.
And is that a wood? Did he went out and got a wood board? I wonder how much Barilla had to pay to get there.
Yeah. He has the most important thing is to mark your counter to know where the contaminated side is and the non-contaminated side.
The most important side is you realize he only wiped down 2 surfaces of an 8 surface of a 6 surface rectangle.
This is what happens when you lose your fantasy football league and the
bet was
world.
to look yourself like you're an idiot.
Yeah.
And pull that over as well, and I drop that into the dirty area also. Finally, I clean my hands.
Now you have a dirty area in your house.
You know what this room?
Dude, he's laughing. He's like, that's such bullshit.
That's so dang funny. No, back when I was in the Army, they had us do, you have to do NBC, nuclear, biological, and chemical warfare training. And that's what you do is you have a big area, and you come into it and you're not allowed out of that
Right.
dirty area, and you have to wipe everything down. So everything he's doing is nuclear, biological, chemical warfare training. It's just so funny that he's sitting there with an airborne, and they knew then it was airborne. He's sitting there showing you how to do this, and he's standing right here. Okay, right here, you do it. Right by his mouth.
As he's breathing.
He didn't say put on a mask first. He didn't say, hey, make sure there's some good ventilation. So that's actually pretty funny.
And I think the important thing here, again, is that this is hindsight, and we know more about the virus now than we did then. The challenge, though, is that the idea that we would have the people in charge get together and basically debrief and say where did we mess up and where could we improve for the future has now just turned into a political fight.
Yeah. I mean, I saw that, like I said in the beginning, when I'm watching these hearings with the House Judiciary Committee going over some of this stuff, it's political. It's 100% political, and it needs to not be. And as I mentioned, I'm very much a centrist. But you have people on the left who are trying to make it all about a vaccine, and they're saying that the people on the right, Jim Jordan and Massey, I haven't watched all of it yet. I'm going to finish watching it today, but they're saying that those guys are all anti-vaxxers and making it all about the vaccine. But I'm not seeing that those guys are making it all about the vaccine. It's the two Democrats that I listen to, Correa and Massey. They're making it all about the vaccines and saying you guys are saying all of the vaccines are bad, and that's really not true. I mean, I've never been an anti-vaxxer. I never got a COVID vaccine. Does that make me an anti-vaxxer now? I mean, I guess maybe. So
we talked about distancing, we talked about masks, and then then the COVID vaccine. And I think that was the one, telling me what I can do with the mask and the distancing. Obviously, there's some social pushback on that. But then telling me that I have to inject something into my body, and if I don't do it, that I will lose certain rights and privileges that I have enjoyed as a citizen for, my whole life. But now I have to do this in order to participate. I think that's where it got really challenging. You started to see a lot of divide.
Yeah, I mean, that's actually where it pushed me. I went along with some of the other things they did. And I was, in 2020, I was very carefully listening to, I shouldn't say carefully, but dutifully listening to a lot of what public health. And, and I listened to a podcast. People ask me this, why did you decide not to get vaccinated and not allow your kids to get vaccinated? And what it boiled down to is, I listened to a podcast that Dr. Fauci did in, I want to say, August of 2020, where he talked about the studies and what they were doing, and he was talking about how they were successful at preventing, death or severe illness in these primates and the monkeys they were testing it on. And, and I said, oh, well, that sounds great. That sounds great. But as soon as it came out in the media, they were all talking about how it prevented everything. And Dr. Fauci in this podcast in August had been saying all of the primates got sick. They all got the virus, but none of them died. And that's a far cry different. And as soon as I saw that they were lying about that, that's when I lost confidence. I said, there's no way I'm getting one of these.
Well, I think a lot of people saw that, where the initial promise of the vaccine is that it would protect you from getting it.
Yeah.
And then the next one was, well, you'll get it, but the symptoms will be less. And then the next one was, well, you'll get it, and the symptoms will be pretty hard, but you won't die. And then the next one is, you might die, but fewer people will die than if they didn't get vaccinated.
Now it's if you got vaccinated, your chances of getting COVID are going up.
So you didn't vaccinate, and your kids didn't vaccinate.
No,
you didn't vaccinate your kids.
And none of us have had COVID.
Yeah, our family. Well, that's interesting because my family all vaccinated, and for 3 years consecutive, I got COVID on New Year's.
Dude, if I was you, I'd skip New Year's. Whose house you going to?
Well, I didn't get it last year, so I think I'm good.
Oh, okay, that works.
Yeah, it's interesting. So our story of being vaccinated was, I'm generally a pretty trusting person in medicine and in government, and I'm becoming less so with not so much the way we behaved during the pandemic, because I understood that there were a lot of people trying to make very important decisions, and you can't expect everybody's going to make the right decision. I'm mostly disenfranchised with looking back that we can't seem to have an actual conversation without everybody declaring their side first
and getting pissed off.
So we vaccinated mostly because I felt like, you know, it was what I needed to do as a responsible citizen. And
so you're calling me an unresponsible citizen?
No, but that was my personal decision. And yeah. I never faulted you for, in fact, I don't think I realized that you never got vaccinated. So it was never, and we've worked together for 10 years. And so it was never a part of that. But my kids, I will say, when it was time to get my kids vaccinated, I was much more cautious, and I had a lot more conversations. Just knowing that generally medicine is different for children and dosages and stuff. And an emergency use for an adult, you know, seems like a fair risk, and adult metabolisms are different and adults react to things differently. But then saying, hey, we're going to go ahead and take that to children without this additional testing and without all of the data and stuff. And we ultimately got our kids vaccinated. Candidly, we pulled the trigger on vaccination for our kids because we had planned a trip up to Banff, Canada, and we weren't going to be able to get across the border unless they were vaccinated. And it turns out that we didn't get across the border anyway because they kept pushing out when it would be open, and so we didn't make it to Canada anyway. But
are you saying our Canadian border is a little tighter than our southern border?
I think that's podcast 9.
Oh.
So this has been a really interesting conversation, because what I want to get, what I would love to see is just more open dialogue instead of whose side are you on.
I would like to see more open dialogue, but I want to see the dialogue pushed outside of the pharmaceutical realm, because I think the myopic focus that our culture and our society has, expecting that the solutions to healthcare issues are going to come from pharmaceutical, I think it's myopic. I think it's idiotic. I don't know any other way to do it. I mean, I know that doctors, physicians are really, they don't like this stat, but it's true stat, and that is that plumbers and sanitation workers have saved more lives than doctors ever had, and more lives than pharmaceuticals ever have, because they're the ones that are taking care of getting, you know, the waste taken away and the clean water to our houses. And I think that has done more in public sanitation, than any of the healthcare industries out there.
That's a great point.
So if you really want to give someone a hug for saving your life, go get your plumber.
And see, ultimately, that should be where the conversation is around, is how can we improve sanitation and hygiene?
Yeah.
Instead of react to something.
And more drugs.
I think the other piece, you know, so there's the distancing, there's the masks, there's the vaccine. I think the other thing that was really challenging was how quickly they pushed back on the origin side. Ooh. Where there was a very specific, this is natural, and yet I thought, you know, they should change that saying that if it walks like a duck and it quacks like a duck, it's a conspiracy. Because when you pointed out the very obvious, they would always say, "Oh, you're just conspiratorial." We've been told that it's, you know, that it came natural origin.
Yeah, I believed it came. I believed it was a natural origin. I had never ever watched an episode of Glenn Beck until my brother sent me, and he goes, "You got to watch this." And it was his special that he had, where he went back and he followed it, you know, all the paperwork, and had the studies and the patents, and had, the emails and all these things talking about the whole 10-year history of the gain of function research that was going on at UNC, University of North Carolina, and Ralph Barrick and the Wuhan Institute over in China. In fact, I don't even know that I knew who Glenn Beck was up until then. I think I probably thought he was some kook TV personality. So
yeah, I just couldn't wrap my head around
Glenn Beck being right.
No, I couldn't wrap my head around the coincidence, right? And I remember hearing that and thinking, well, maybe the Virology Institute is located in Wuhan because it's very close to where this stuff comes from. But then they're like, well, this came from 800 miles away. So there wasn't even a proximal argument to it. It's just, and then, the stuff that's come to light with the communications between Fauci and the group. But I think that it wasn't that they said that it could be natural or it could be from the Wuhan land. It was that if you said or you felt or you thought that it came from that lab, you were wrong and you were promoting misinformation and you were essentially a bad person for thinking that way. And I think that's what's lost a lot of trust with these agencies and these health services, that there wasn't any discussion or dialogue going. We were just shutting down any questions if they weren't the right questions.
Yeah, I mean, we could go on and on about how it was handled badly, but I think, I just want to read a quote from Dr. Fauci, the great Dr. Fauci, I still believe that he should be trying out for the picture for the Washington Nationals. I think he did a great job throwing that ball out. But, what Dr. Fauci said, he said that when you make it difficult for people in their lives, they lose their ideological bullshit and they get vaccinated. And I think that saying stuff like that is the exact opposite of what people in public health should be saying.
Right.
And really, I just want to say bullshit.
That's interesting. It's a view of, I am not part of that group. I'm outside of that group, and my mandate is to make sure the group does what I want it to, versus we're all in this together.
So what you're doing is you're actually making a very good segue for a future podcast. Congress mandates that we cannot do any insider trading, but yet Congress themselves can do that.
Oh, that's a great podcast.
I mean, my own congressman, who's now a senator, he's famously right up there on that list with Nancy Pelosi. Love him for it.
Yeah.
That's a shout out to you, John Curtis. Anyways,
do you want to?
Yeah. What do we say to wrap this up? I just want to thank you for joining Shad and I for another episode of our Clear the Air podcast. Hopefully you found it interesting and entertaining and you learned something.
Thanks, everyone.
This episode of Clear the Air was hosted by Nate Jones, co-hosted by Shad Slaughter, produced by David Monk, associate producer Matthew Davis. Video and audio were edited by Caleb Scoresby. Research by Sabre Bills. Music by Augusto Diniz. If you enjoyed this episode of Clear the Air, be sure to follow, like, and subscribe so you don't miss out on the latest episode. Have a favorite episode? Share it with a friend. New episodes of Clear the Air are published weekly on YouTube, Spotify, Apple Podcasts, or wherever you listen to your podcasts. Thanks for listening. We'll catch you next time.
Just put a little thing on there, like, recording in an active warehouse on the podcast.
We'll leave a little disclaimer at
Yeah.
the start that says,
Yeah.
FYI.
This is the government censoring us in the background?
You can hear the police cars. Those are government police cars.